Unleash the truth. Are no sugar drinks actually healthier? After a long day at work, you need a chilled can of soda, but you already know it contains too many calories, so you go for the no sugar soda instead. But there's one little problem. You don't know about the dangers of no sugar drinks. Just how bad are they? Let's find out. For some people, getting through the day without their favourite sugar-free beverage is an uphill battle. But whether you prefer diet sodas, sugar-free flavoured sparkling water, or any other drink that claims to have zero sugar, you're exposing yourself to certain dangers. But what is the purpose of diet drinks, or zero sugar soda, in the first place? Regular soda comes with a lot of sugar and calories, which has been linked with a lot of problems such as weight gain, obesity, diabetes, and several other diseases due to their high sugar content. Thus, the basis of no sugar drinks is to replace the sugar content with no calorie artificial sweeteners, which are many times sweeter than sugar while achieving the same sweet, refreshing taste. Now, these sweeteners could be either nutritive or non-nutritive. Examples of nutritive ones are xylitol and sorbitol. You might have seen some of the non-nutritive sweeteners on the labels: saccharin, ACE-K, sucralose, and aspartame are popular examples. Comparing nutritional values. A 12-ounce or 354ml can of Coca-Cola Zero Sugar contains 0 calories, fats, protein, sugar, and only about 2% of the daily value of sodium and potassium. In other words, no sugar Coke has no nutritional value. Meanwhile, a can of regular Coke contains 140 calories and 39 grams of total carbs. The average 600ml bottle of soft drink contains about 16 teaspoons of sugar and about 1,000 unnecessary kilojoules, and this is more than the WHO's sugar recommendations of about 12 teaspoons of sugar per day. Although there is some debate on the effect of these artificial sweeteners on the body, these are some of the scientifically proven dangers of no sugar drinks. 10 dangers of no sugar drinks. Weight gain. Despite being sugar-free and containing far lesser calories than their sugar-containing counterparts, no sugar drinks could still cause weight gain. One study published in the Yale Journal of Biology and Medicine showed that natural sweeteners activate food reward pathways in your brain, while artificial sweeteners don't fully activate the pathways. This leaves you unsatisfied and can make you crave more sugary drinks or snacks despite already consuming enough calories. When your increased appetite leads to more calorie intake, you'll begin to gain more weight, and if uncontrolled, you may quickly become overweight or obese, and this could lead to the next problem, which is metabolic syndrome. You may experience metabolic problems when you have an enlarged waistline, high blood pressure, abnormal fasting blood glucose, and increased cholesterol levels, and all these come from the uncontrolled appetite and weight gain caused by no sugar drinks. Metabolic syndrome increases your risk for developing heart attack, diabetes, and stroke. So if you notice that you have these symptoms, you might be dealing with metabolic syndrome. Here's the next danger sign: poor gut health. Research has shown that diet drinks could disrupt your digestive system in several ways. They could affect the microbiome in your gut, affecting immune function, nutrient absorption, and your heart. Saccharin, which is an artificial sweetener, causes impaired blood sugar management. Also, another sweetener, called acesulfame potassium, or ACE-K for short, increases blood insulin levels and may reduce its sensitivity to glucose. Although most of this research was carried out on animals, it might be a good idea to watch your gut health when consuming diet drinks. Generally, diet sodas do not contain any fibre, and that could affect your beneficial gut bacteria too. Another unpleasant effect on the gut is abdominal discomfort. Sugar alcohols such as sorbitol and mannitol cause bloating and diarrhea, since they're more difficult to break down, especially when you take them in large quantities. Another possible health risk is poor oral and bone health. No sugar drinks still erode the tooth enamel despite not containing sugar. Their high acid content wears out your enamel over time, and could affect your smile. Diet drinks could play a role in the form of tooth cavities, gum inflammation, and other oral health problems, so it's advisable to limit their intake, or at least use a straw when drinking them, because they contain phosphoric acid, which has been shown to cause enamel and mild tooth erosion. This same phosphoric acid also causes excess calcium to be released in the urine, and remember that calcium helps to strengthen bones. Over time, your bones may weaken and become more fragile. Next is cancer. There have been several rumours and inconclusive studies on the role of no sugar drinks in cancer. Although one cohort study revealed a 30% risk of cancer in those who consumed a lot of artificial sweeteners, there are many factors involved in developing cancer. The truth is that there's no hardcore evidence to support the fact that no sugar drinks could cause cancer directly, but the mere fact that the studies have revealed mixed results is a good reason to avoid them in the first place. Kidney disease. You might be at risk of kidney disease if you consume several cans of no sugar drinks every week. The high phosphorus content in sodas could cause kidney damage by causing injury to the renal blood vessels and increasing acid load on the kidneys. If you already have problems with your kidneys, diet soda may worsen it. Preterm delivery. Another symptom noticed to be associated with diet soda is preterm delivery. Some research was done on a group of pregnant women and negative outcomes were observed, but it didn't just end there. Most children suffered from childhood obesity afterwards. Headache and dizziness. For many people, drinking multiple servings of no sugar drinks daily could be associated with headaches and migraines because of the presence of aspartame. Aspartame inhibits the release of serotonin and dopamine, which are the hormones that make you feel good and improve your mood. Another reason for headaches may be the presence of caffeine in some diet sodas. Caffeine narrows the blood vessels, and after its effects wear off, the blood flow increases and can put more pressure on the surrounding nerves, causing a sort of withdrawal headache. Depression and anxiety. Also, because of its negative effects on the reward hormones serotonin and dopamine, diet soda could be linked with depression. There is some evidence to suggest that those who drink multiple cans of no sugar drinks a day may have higher risks and rates of depression. This is even worse for those who already have pre-existing or underlying problems with their moods. Liver problems. Consuming these artificial sweeteners could also cause fats and lipids to accumulate in your liver and cause it to undergo certain changes that will reduce its function. Why should you avoid artificial sweeteners? Although regulatory bodies in the United States and Europe have no problem with artificial sweeteners and have even declared them safe, few studies show that they may pose some health risks to you. Besides, there are long-term safety concerns to be wary about. Even though artificial sweeteners may appear healthier than drinks packed with refined sugar, it would be a good idea to limit their intake and focus on more natural options. Since zero sugar drinks add no nutritional value, it means that they almost certainly cause more harm than good. If you want to reduce your sugar intake, healthier options include low sugar drinks such as herbal tea, black coffee, and fruit-infused water. Also, not all no sugar drinks contain sweeteners, so be sure to check the label to know more about the drink you're consuming. Artificial sweeteners could be a good short-term option for people trying to reduce their sugar intake and manage their weight. However, we must take care to understand how they affect our food and drink choices and health in the long run. Meanwhile, more research needs to be done to effectively understand the association between no sugar drinks and these health risks. But keep in mind that there is some relationship between no sugar drinks and obesity, kidney and liver disease, headaches, depression, cancer, poor gut health, poor oral health, and preterm delivery. The healthiest drink in the world is water, and the ultimate goal should be to replace all fizzy, low sugar and no sugar drinks with water. Other healthier replacements to take occasionally could be a glass of natural fruit smoothie or low-fat milk, because they're a lot more nutritious than both diet and regular soda. As usual, always consult your doctor, dentist or dietitian on any changes to your diet. How many times a week do you drink soda or non-soda drinks? Share your thoughts. Also, check out the next video for more health tips. But before you do that, subscribe, like and share.